We have a patient who is 34, has got very strong family history of overweight, and she's been highly educated in such a way that she has actually seen the processes what the family has gone through from being obese. That means the family had heart problems, diabetes, and also joint problems. And she decided that she doesn't want to go through these processes. What measures I can take is what she has chosen at this age. She's overweight with a body mass index of 36. Her weight is 80, but her height was shorter, so hence the BMI gone up. The most important lesson I learned from her was that she can see herself that she wants to live a healthy life. And that's why she decided that she wants to do certain measures to prevent it. One of that is that she's taken every action. What most people do is lifestyle modifications. That means she's followed what diet have you followed before?
Intermittent fasting.
Intermittent fasting and various other diets she has followed. She cut down her calories, and then she was doing exercises. What type of exercise were you doing?
Yoga, treadmill, and even I tried jogging also.
Jogging also. And has any of these helped you at all for weight loss?
No.
Okay. So this is not the first time we hear this type of stories, where a lot of people, they try to do their normal weight loss lifestyle modifications to lose weight, which includes diet and exercise, but only 3% are being successful to sustain their weight loss. They might lose a little bit of weight in the beginning. This is because of unknown genetics that contribute for it, which is exactly the situation where she has actually foreseen this because she's highly educated. She works as a associated director for pharmacy company. And she doesn't want to put herself in the shoes of her family. And that's what she's done. And then she's researched a lot, and she wanted some procedure that does not involve surgery. Is that right?
Yeah.
Okay, and you did not want to have any surgical sleeve?
No, I didn't want to go through the pain of undergoing a surgery.
Yeah. Hence you choose the non-surgical sleeve.
Non-surgical sleeve.
Non-surgical, non-painful endoscopic sleeve, which is called endoscopic sleeve gastroplasty. And you had the procedure yesterday, and it's less than 24 hours, is that right?
Yeah.
And what's your experience from this?
It's good. I mean, there are certain complications after the procedure, but they are very minor, and
Do
it's
you say
something.
complications or the discomfort?
Discomfort. I would rather put it as discomfort, but I think that too only for 2 to 3 hours after the procedure.
So those are like cramps.
After that, rest all is fine.
Yep. So normally, procedure which includes tying the stomach into small volume, which obviously going to make some cramps because the stomach is normally expands and then does give the feeling that it needs to open up. That's what the cramps does. And we give medications to help that. I think it's not a complication, it's a part of it.
Yeah.
Yeah? Okay. So, and then she recovered very well within few hours. She had a peaceful night, she slept well.
Yeah.
And did you have anything to eat this morning?
Yeah, I had a cup of watermelon juice, and again I had around 30-40 ml of vegetable soup, so it's fine. It's fine.
Yeah, it's less than 24 hours. She had her liquid diet, and I guess she's going to do well, and I want to see the good results for you.
Yeah.
Do you want to say anything from your point of view?
Yeah, I actually consulted many doctors regarding the issue that I have, and many of them suggested diet, and some of them have suggested weight loss medication like Orlistat and all that, and some of them have suggested for a surgery like bariatric surgery, laparoscopic sleeve gastrectomy, gastric bypass and all that. But I didn't want to use any weight loss medication where side effects are more, and even I didn't want to go through a surgery. And then I met Dr. Puli, and he actually gave a lot of confidence, and all that you need to do is just listen to him, that's all. And he will do his best for you.
Okay. And were you surprised to see me late night last night?
Yeah, I was.
I came at 11 o'clock just to check on you, that how you doing at hospital, yeah?
Yeah. And I'm very thankful for him for all the care and support.
Okay. Thank you very much. Okay, what I would like to give an advice is that people don't need to wait very late in life because the complications from overweight are much higher. People tend to have heart attacks and diabetes. You don't need to put up with it. And people like her has seen those things afar ahead and would like to take the lifestyle in their own hands. And that's what I would say. And there are options which are non-surgical, which can help them to lose weight. And they don't need to be in hospital long. She's going to go home any moment now. Yeah, and they stay in hospital less than 12 hours. And they go home, it's non-painful. She's sitting, she's walking, she's eating within a very short period of time. Thank you.